37 days into the ongoing face-off between the National Association of Resident Doctors and the federal government over their demands, an agreed memorandum of action which was signed by both parties, but somehow reneged upon by one of the parties, and NARD has gone on strike to try and force the federal government's hand to implement that, and that's why we're counting 37 days now since they have gone on strike. However, that track which you saw there was the Minister of Labor, talking about what the federal government is willing to give. That happened over the weekend, I think on Sunday or thereabouts, when he was saying that if the doctors do come back to work, they will withdraw the case they have in court against them. The question is, will NARD, that's the National Association of Resident Doctors, will they accept that offer? We have with us in the studio this morning Dr. Uyilawa Okwayesuyi, who is the President, Nigerian Association of Resident Doctors. You're welcome to our studios this morning.
Thank you, Mark. And thank you for pronouncing my names very well.
Well, it comes with practice, doesn't it? You've been a lot in the news these days, and it looks like it's taking a toll on you somewhat. I'm wondering, when would you say the grounds would begin to shift? Because the stance of NARD is that we went on strike to force you to implement your own parts of the agreement, but the federal government is saying that when you do go on strike, there are consequences. I mean, the no work, no pay rule should apply. However, they say, much as we've taken this matter to court, we're willing to withdraw it if you come back to work. What are you willing to give?
Thank you very much. And apologies to Nigerians for towing this line again. We went on strike on the 2nd of April and started under one on the 2nd of August. It has been seasons of recurrent strike, basically because one group or one set have refused to honor agreements made. It's quite sad when, after a memorandum of actions signed over 151 days ago, 31st of March, 9th of April, and we are back to this stage again. I'll start with analyzing everything. We lost 19, we lost 2 more now, meaning we have lost 21 breadwinners.
21 who? Doctors?
21 resident doctors.
Owing to what?
To COVID-19. And we have a system that tells you all health workers have been insured. Death in service insurance and compensations for the next of kin is more like a mirage now. The head of service then, at the instance of the Speaker of the House and the Honorable Minister of Labor, said the country have brought about 995 million to help insure all health workers. And up till now, 2 additions to the 19, no death in service insurance to any of our members. Or members on the Gift Mix platform.
Dr. Kwesi, yes, much as we really want to know, I'm sure that a lot of Nigerians over the period of the strike, because you have made a lot of media appearances to state the grievances that you have against the federal government, to say these were the agreements, these were the grievances we had against them in the first instance, these were the agreements that we reached. We not only reached an agreement, but we also signed a memorandum of action. A lot of Nigerians, I want to believe, are well aware of that particular stage and a lot of the things that were in that memorandum of action. However, the federal government has said, yes, I don't know if they have accepted that they were the ones who reneged or they're the ones who haven't moved. They say, oh, we have been working behind the scenes, but the system is very slow. Bureaucracy has been, you know, how will I put it now, tying their hands. And they have also given their own explanation as well. We have been made to understand that if a doctor, for instance, were to resign today, it would take him only a month. However, to replace that same doctor would take nothing less than 6 months, for instance. And this is all owing to bureaucracy, the fact that waivers have to be secured, etc., etc. The question is, knowing all of that and tabling it, because I'm sure you have been having meetings with the federal government, and this is what they're now offering. What will be the minimum requirement for NARD? Because I'm not sure that you're happy that you're on the strike. I'm sure that you want to be able to give your service to Nigerians. What will be the minimum requirement for the NARD to say, look, we will not only come back to the negotiating table, we'll be willing to go back to work if you meet this minimum condition?
Thank you very much. First, minimum requirements. We want all members on GIFMIX to be paid. They are owing 5 months to 7 months salaries up to now, and nothing is done about it. The 114 house officers are still not being paid. The Medical Resident Training Fund is still not being addressed. We signed a document over 151 days ago.
So you want 114 officers who are being owed
they should
to
be
paid.
The members on GIFMIX should be paid. Now, the Nigerian Association of Resident Doctors are saying the season for a change in the medical sector is now. We do not want to negotiate with Minister of Labour and Minister of Health. We actually think that for Nigeria to have a better health sector, those people also have to be changed. We are adamant and we insist on this. You cannot go to the presidency and be feeding wrong informations and come on TV and said the 12 things they have done have been met when you are signing another MOU after 151 days. The people that have not been paid, have you asked them how they have fed their families? Have you asked them that school is resuming now in September, how they are going to go back to schools for those children? Have you asked them how they are able to pay their rents? Somebody is not doing their job and they are sitting down in their tables. They are enjoying COVID allowance that was paid to them. They have enjoyed all salaries and not on DTAs for extra time being spent when negotiating with us. And we are bearing the brunt, and Nigerians are suffering. There's a season for everything. If the health system have to move forward, there need to be an overhaul of the entire system.
And I think that to a large extent, there is nobody who will not agree with you. You have seen the support. We've heard the NMA, you know, even threaten a strike action on behalf of NARD. We've seen MD Khan, the Medical and Dental Consultants Association of Nigeria, also threaten an action, even though they said it was also to correct a few things. And we could see that immediately the federal government, moved to action. And they have also spoken up in support of NARD. So it would seem that within the medical sector, the people who should have your back have your back. Even sister unions, Joheso, we understand, has also been speaking up on behalf of the health sector. So nobody can begrudge the fact that what you're asking for is not your right. It is. However, you know, when we look at how long drawn this is becoming, and also the number of lives that we're going to be losing as a result of this, and also the fact that, you know, we have cholera outbreak in many states, we have COVID-19 now back in full force, it would seem. Sadly, you've lost 2 additional members of your group to this deadly disease. I'm just wondering, apart from this, I mean, assuming today the federal government were to pay the 114
house officers,
would you call off a strike?
We had an intervention by the Vice President, Osinbajo, on Friday, where we spoke for over 1 hour, 45 minutes. In what the National Health Service Committee have realized is that the biggest problem we have is from the Minister of Labour. I can tell you that if I go back to my members and they ask for just one person, and we'll call off the strike. We'll ask for the Minister of Labour to be removed. And we'll call off the strike. Not concerning the no work, no pay, or any other thing he has done. For feeding Nigerians and the presidency lies. He comes on air regularly, misinforming Nigerians when people are dying. And tells you he's a medical elder. I wonder in years to come what legacies we have left behind. I'll give you examples, please.
This is very personal.
It's not personal now.
No, to the Minister of Health. I mean, the Minister of Labour.
I'll tell you what, Ma, is the chief reconciliator of the federal government. What has he reconciled? ASU is threatening to go on strike. JSU is threatening to go on strike. MD Khan is threatening to go on strike. NMA is threatening to go on strike. Virtually all sectors in Nigeria wants to go on strike. How many reconciliation has he done and gained to make people go back and do the right things?
You say that the Minister of Labour has been feeding the government lies. I mean, those are your words. Do you have evidence to show that indeed it was he who was actually giving the government, assuming there were some presumptions that were not correct on the part of government, that it was from him that those presumptions emanated?
Memories never lie. On channels here, he said the presidency was told that we have met 12 of virtually all their demands. I think we need to chronicle it down. The debt in service insurance is still not met. After 151 days, the members on GiftMix platform are still owed 5 to 7 months. It has not been met. The capturing of the members of GiftMix and those locum officers that have been casualized by the chief medical directors has still not been met. The medical resident training fund, as of 3 weeks ago, was promised to have been paid, to be paid. It's still not been paid. The minimum wage adjustment allowance is still not paid. The shortfalls of 2014, 15, 16 have still not been met. And you come on air and tell them that you have virtually met everything done, and because of that you are applying no work, no pay. What have been applied to those that have not done their jobs? It's sad and disheartening when we lose people to cholera, to COVID-19, to Ebola. And you think you are doing Nigerians a favor, that you want to apply no work, no pay. You think that will scare us?
Well, it's obviously, you know, the directive, it will seem, is obviously making doctors even more angry. But what I would like to know right now, because last week we also saw, this is at the federal government's level. The federal government also claims that a lot of the things which NERD demands is at the level of the states. And last week, we saw a meeting, the SGF, the Secretary of the Government of the Federation, summoned a meeting of the commissioners of health in the different states to Abuja here. I don't know if you're aware of that meeting.
I am.
Okay, the subject of discussion was improving the healthcare and what the states need to do. I don't know, I want to imagine that it's also out of concern for some of the things that you have asked, and also how it is that they can carry the states along that meeting has been held. Are you confident that after that, because a number of states are owing their resident doctors, some we understand as much as 20 months, and if you solve what is happening at the federal government, how will it, you know, affect the states where it would seem that you have majority of your members? Any conversations along that line?
I spoke with the Commissioner of the Cross River State, Dr. Betty, and you'll be surprised to know that even the Minister of Health was not in that meeting. When all commissioners of health in the country are coming down to discuss the affairs of the health sector.
The Minister of State for Health was there.
The Minister of Health, Dr. Saigi Haniri,
I know, but the Minister
was not there. Has he ever been in any of our meetings? I get emotional when you know there's a problem in the health sector. And those in charge are giving you stories or are not taking responsibilities for what is happening to the health sector. There's a decay, and the decay is deep. And it's quite unfortunate that people are paying with their lives.
No, I do not know. So I'm not making any excuses for the Minister of Health. We do not know why the Minister of Health wasn't there at that particular meeting. But as I did mention, the Minister of State for Health was there. I want to imagine that, you know, they're working together as a team in that particular ministry. But just to also mention to our viewers that the Minister of Labour was contacted when we were doing this program, and we're still hoping that somewhere along the line he'll be willing to give us the federal government side and also let us know just how far the federal government has gone in resolving some of the issues raised by the National Association of Resident Doctors, and also to bring this strike to an end. But, you know, as I was saying, that the Minister of Health wasn't there. We don't know whether he had challenges. We don't know what challenges he had, and you know, it might be very difficult to judge him based on the fact that he was absent from that meeting. But when you think of the fact that the Minister of State for Health was there, don't you think that that, you know, shows some seriousness on their own part?
I actually disagree, ma'am. It's 151 days. We have met, we have been on strike, we have had several meetings. And I can tell you, ma'am, of all the meetings we have had, it's just twice which he barely stayed. It gives you an excuse.
That's the Minister of Health?
Yes. It tells you and gives you an excuse that I have the presidential engine to the briefing and leaves. And the health system is burning.
You think he's hamstrung? Do you think that there's very little he can do? Maybe it's out of his powers.
It's the willingness to work. The willingness to prevent the health system from going down. The willingness to prevent the JOHESU, the MDCAN NMA from going on a strike on the 18th. How do you make the system work? Years back, virtually people come down to Nigeria to seek good health care in the 50s.
The decay did not happen overnight. Indeed. I mean, we know that there was a time when we used to have people coming to Nigeria for health care. We were a health destination of choice. But the decay that we're witnessing today did not happen overnight. We heard on tape the Minister of the SGF during COVID-19 visiting hospitals and saying that they didn't know that the decay was this bad. And it didn't happen overnight. And it will not be corrected overnight. However, the fact that you're on strike is not going to resolve this overnight as well. So, again, because you have given me two different minimum requirements now. The first is that, you know, your members who are on GiveMe's platform must be paid first. That's the minimum you are saying. The second is that you want the Minister of Labour to go.
And health. We should add health to it.
Which one of them is which?
Both of them are not doing their jobs.
No, what I mean is, which one of them is really the minimum requirement?
We had an MOA. Of the MOA, we had 12 things there. We brought it down to 5. I'll break it down. The GiveMe members on GiveMe's platform and locum doctors that are casualized, we said, capture them into the IP system, give a waiver, which they said they have given over 2 weeks ago, and they're not still being captured. Pay them what they have worked for.
Just quickly chip in that, you know, the most likely of the two which you have put forward is the fact that your GiveMe members might be paid. The members on GiveMe's platform. Would that be sufficient enough for you to come back to work?
You must add the second one you said.
I didn't say it.
I said it.
Yes.
That the 2 of them that are not doing their job should leave their office. We insist. We are deciding to start a peaceful protest from next week, where all doctors in Nigeria are going to wear a black work coat, and we'll move around all hospitals for at least 2 hours to show that we mean business. We don't untwist people. We want to go back to work. Some people are preventing the good things we have done.
This is despite your meeting with the Vice President.
The Vice President is our only hope. But unfortunately, we met with him on Friday. On Saturday, we are getting the wrong information from the Minister of Labour. That's personal.
Okay, let's quickly flip this to my colleague in Lagos now, Kayode.
Well, thank you, Mark. I just want to also clear, because it's important to find solutions to this. When we talk about the minimum requirements you need to resume this track, that's what a lot of people want to hear. I mean, and then they can now say, government, they have laid their cards on the table. What's your next move? So you mentioned payment of members 114 on GIFMIX. You talked about the medical residency training funds. You also, I didn't hear you talk about that case in court. And the whole victimization that you have referenced time to time. And I just want to also clear this. So these issues of payment of members of GIFMIX, the medical residency training funds, I mean, these are essentially, they sound like budgeting issues, payroll issues, things that essentially will be at the Ministry of Finance or Budget and National Planning. So are they still really at the hands of the Minister of Health and Labour, especially these particular issues that you raised?
In any system to work, there must be a planning. Actually, in the health sector generally, there's a planning department in the Ministry of Health, giving a roadmap of how things are going to be achieved. On these payments, we have been promised and been addressed by the DG budget. The Minister of Finance was involved. They told us that the funds were available and it was going to be sent to the Accountant General's office. It was said on air by the Minister of Labour that we are going to recover what was looted by residents. I feel that is a misnomer. The list sent by the Postgraduate College, National Postgraduate College, to the IPs and to the Ministry of Health was also verified by them. They had no idea that they made wrong payments based on that list. We wrote since December and January to the Ministry of Health, the Accountant General's office, the IP's office, informing them that some people were paid in error, that we needed an account number where those monies will be paid back. Members are paying back. We actually also told them about 9 months ago that some may need to pay in bits, that if it can be deducted from the IPs, shows that we have integrity and want to do the right things. So it would be wrong to say on air that looted money for residency training when you did not even go through residency. Some people benefited then from the health sector when they were giving scholarships, which is the one the Minister of Labour benefited from. He actually said twice on channels. We don't benefit from that. For an average resident to do residency training to become a consultant takes an average of 6 to 8 years, depending on your specialty. And those in family medicine have about 7 updates and tend to pay up to virtually $1 million or 1.5 million naira every year. And you come on air and tell us that we're giving 540,000 to buy books. Stop feeding wrong information. You know, 114 of our house officers are still being owed. They should be paid. The members on GIFMIX platform and the locum that are casualized should be captured and be paid. The medical residency training fund should be paid to our members for those 2020 and 2021. And the removal of the Minister of Health and Minister of Labour, then we'll call off the strike.
You know, it sounds a little more tricky, because if those are the additional or new conditions, you know, with which you have to call off the strike, many just thought, well, because when they hear you say that the VP is your only hope, so why is it that you don't think that the VP can, if you feel the other ministers are not conveying the right message, can the VP then convey that message, you know, rather than you asking for these ministers to be sacked? Because, I mean, if those ministers themselves hear this, and of course they will be angry, so who knows if that may throw spanner in the works of further negotiation, because this appears to be a system thing not just about those two ministries or ministers?
Thank you. It's more like an ego thing now. If the Minister of Labour heard that we had a meeting with the Vice President and he's already intervening, why go back to the presidency the next day to give a wrong impression that we are insisting that you put no work, no pay on paper? Those that did not do their job, what penalty have been melted on them? It's the big question we have been asking for over 151 days. Some people are not doing their jobs. Nigerians are dying because of the decay they have brought into the system. Maokwe said that it has been a consistent thing. But it's same people that have been in the same pipes.
I thought the decay did not happen overnight.
Yes, I know.
I said, yeah.
And it's same people. The Minister of Labour have been there since 1991.
As Minister of Labour?
Yeah, he worked in the ministry. The documents we signed about the hazard allowance was written and compiled by him. He was part of those that negotiated the hazard allowance of 1991. And up to now, we're still scrambling on how to improve on the hazard allowance. 1991. Was he not there then?
Well, this is where we are today, that you are on strike 37 days into the strike. And I'm sure a lot of Nigerians are anxious for this strike to come to an end. Yes, when you go on strike, what you want is for Nigerians to cry out, put pressure on government, and, you know, for government to accede to your demands as well. But that hasn't worked so far. So I'm wondering what other, because people are saying, you know, the use of strike doesn't punish government. It punishes the people who haven't offended the NERD. So how do you think that you can use this in such a way that the people who are most affected by the strike action which you have embarked upon do not feel it as painfully as they're feeling it?
Thank you, Maokwe. If we get strong commitment, I can put myself on the line. If I get strong commitment from the Vice President of the Federation, and I see that we can be able to take it and sell it back to the National Executive Council, we'll do by all means find a way to call off the strike. Because it's a trust thing. It's not personal. If we have somebody that has integrity and we can trust, not the ones we have discussed with earlier.
So you believe that the Vice President has the integrity?
He has integrity, he has trust, and somebody I believe can make things work.
Well, it's a fine place to leave it. Let us hope that your hopes will not be in vain, and that of Nigerians as well, and that this will be resolved even faster than, you know, we thought it was going to be, you know, resolved. But we have to thank you once again for sharing your thoughts with us this morning. Dr. Uyilawa Okwayesuyi is the President, Nigerian Association of Resident Doctors. Just to also mention that we did try to get the Ministries of Health and Labour, and they're yet to join us as we speak, but we hope that in the coming days or thereabout, they should be with us on the program to give their own side of the conversation. Well, that's it for the segment. I hand you over now to Chamberlain Osa.
Well, yes, indeed. Thank you, Mark. We'll keep trying and hoping that we could get their perspectives, both ministries, into all of this. But in the meantime, we do have Dr. Rosemary Idanesi. She's a labor lawyer, and she's well-versed at this matter. She's also a senior lecturer in the Department of Employment Relations and Human Resource Management, University of Lagos. Good morning, and thank you for joining us on the program today.
Good morning, Chamberlain. Good to be here.
Thank you. Well, having heard from the resident doctors, the minister, and probably what you might have read and kept tabs on this protracted doctor strike, and wow, because today many actually thought, okay, who knows, maybe the doctors may shift grounds, having heard the Minister of Labour speak, but alas, the doctors have now said, well, actually, the two ministers have got to go, then we call off the strike. How difficult can this be?
It's really a very difficult situation. In fact, that the government allowed the strike to go on for this long, it's beats my imagination, because we are talking about doctors here who save lives. This is an essential, they are providing essential services. Government shouldn't have allowed this strike to drag on for this long. When you bargain in good faith. From what we have heard from both sides and from what we have read, we have seen that there was actually an agreement between the two parties. And part of the reason why the doctors went on strike is because the other party, which is the government, reneged on that agreement. In normal industrial relations parlance, when you negotiate, you are expected to negotiate in good faith, and both sides are supposed to keep to their agreement. When you make an agreement, when you sign an agreement, you are committed to that agreement, and you ought to ensure that you fulfill whatever you have in that agreement, because failure to do that results in the kind of situation we have found ourselves now.
Well, what would you recommend at this point? Because it's not the first time that we hear of doctors or people going on strike in this country, and this it has a history, a huge history. And so what kind of methods for industrial relations can we adopt here? Because remember, this matter was even also I think some sort of arbitration, industrial courts. It also got to that level, yet there's no end in sight.
Yeah, well, before I go to the recommendations, we should look at the situation as it is currently. We've talked about what led to where we are, and as you said, this is not the first time that doctors are going on strike. That is why it shouldn't have lasted for 37 days or so, I hear. Now, the minister was talking about they ought not to go on strike. The law does not allow them to go on strike because they provide essential services. Fine. Essential services are not supposed to go on strike because of the disruption it will cause, especially when you talk about medical doctors. You are talking about lives. People are going to lose their lives. People are going to die. But then, strike is a legitimate weapon, and it is an essential element in the principle of collective bargaining, as affirmed by Lord Wedderburn as far back as 1942. So it's even ILO, though you don't have a convention that actually says, oh, there should be a right to strike. But when you look at the Committee of Experts and the Freedom of Association Committee, they sort of affirm that there's a right to strike. Because if you remove that right to strike from workers, then, it looks, you are removing power from them. How else can they show that they don't agree with what is going on? Or how else can they say, okay, the terms and conditions of service, are not what we want them to be, we want it to be improved. So the right to strike is there. In some constitutions, like South African Constitution, it is enshrined that there should be a right to strike, even in some European countries. In Nigeria, it's not that strike is outrightly banned. It's only in essential services as we are seeing it now. But then, if you don't want people in essential services to go on strike, then you should make special provisions for them, because you are curbing that right that essentially they ought to have as workers. Now, you don't want them to go on strike because you don't want a situation where there will be disruption to public service, or in this case, people will die and lose their lives. Then you should make sure that you have a conciliation or an arbitration process that's impartial and that will be fast and effective, to ensure that if there's any area of disagreement at all, it is resolved very fast in such a way that we won't have the kind of situation we have on our hands. So both parties, sticking to their own extreme positions will not help in this matter. Now we are seeing the resident doctors asking that the Minister of Health should be removed, the Minister of Labor should be removed. But thank God they have confidence in the Vice President. Removal of these people may look like it's extreme, but I think one can understand where the resident doctors are coming from. The way we can resolve this matter now is that government should try very hard. I remember Mokwe was talking about the fact that it may not be in the hands of the ministers of labor and health. Since it has to do with finance, it may be in the hands of the finance minister. It doesn't matter. These people should be working hand in hand. If you are owing these people some allowances or some salaries, please pay them. People are dying. We know that a lot of our politicians do not use our Nigerian hospitals. Maybe that is why it is possible for the resident doctors to be on strike for 37 days and nobody cares. It appears that it doesn't matter. The minister is saying, okay, no work, no pay rule, section 42 of the Trade Dispute Act will be enforced. And yet, that has not scared the doctors. They are still on strike. Because even before you say no work, no pay, you were not even paying them before. That's part of the reasons why they went on strike in the first place. He who is down fears no fall. So they are not even moved by the fact that you say, oh, if they don't go to work, you won't pay them, because they were actually on strike because of that in the first place.
Well, Dr.
Yes,
Ganasi,
government has gone to the...
I imagine, pardon me, I imagine as an academic in the Nigerian context, you'll have rich case studies of, labor disputes. Just in 2 years with the resident doctors, we had 4 strikes. And I mean, that's just in the space of 2 years with just one association. Imagine with others, ASU, NASU, and all. So I imagine how much information you have at your behest. And it's good to actually glean from this, I mean, from the academic world, the kind of research you have done, the kind of information you have, such that government can learn from it. After all, that's why we have the academic sector. So what would have been a perfect scenario to deal with this? So imagine that ASU says, we're going on strike next week. What would you have expected to happen to follow up? You said this is not fast enough. So how would you have expected government and, stakeholders to handle this?
That's what I said that earlier on when I talked about bargaining in good faith and keeping to agreements. If I am a member of ASU, for instance, and over the years, I started teaching in 2002, and in fact, that's like a year after that, or about 6 months after I joined University of Lagos, there was this ASU strike during the time of President Obasanjo. So we have many cases of strikes, in Nigeria, even of the same unions going on strike time and time again. Like ASU, I mean, we've lost count of how many times we've gone on strike, and that has not really changed anything. And what is actually the reasons why people, public servants in Nigeria go on strike, unions go on strike in Nigeria? It is because agreements are not implemented, agreements are not honored, especially by the federal government. If they can honor the agreements they willingly went into without being coerced in any form at all, then why don't they honor those agreements? Because if they do, then we won't have all these cases on our hands. And that has to be the starting point. Honor the agreements. Even when you go to the NIC and say you want to force the medical doctors to go back to strike, the NIC said, okay, you guys should go back to the negotiating table. Because at the end of the day, even when you talk about strike, no matter how long that strike is for, you will still end up at the negotiating table. So it's very important for government to keep to their agreements they've signed willingly with workers. If they do that, then we won't have workers going on strike all the time, and it's not good for Nigeria. So
you believe that government is solely responsible for this over 1 month long strike?
Well, from what I have seen so far, the government is telling us that they've made some concessions, they've done this, they've done that. But we listened to Dr. Uyilawa this morning, and he told us that they are owing salaries to house officers and some other people. You know, so it's like the government has not really done enough. And he said that if those people, workers are paid, that they are ready to go back to work. The one I may not readily agree to is that they have to remove the ministers of health and labor before they can go back to work. But then one can understand that they are not happy with the way those two personnel have handled the matter so far. And I believe also that they should have handled it in a better way, such that at the end of the day, it becomes a win-win situation. You know, nobody really gets how do I put it now? Nobody gets to a point where we will now get all the blame. Like a lot of people think that the government is majorly at fault. We are not saying that the resident doctors are completely they don't have some issues, you know, but majorly when things boil down to financial issues, you know, then I mean the doctors are working for the government. They are not supposed to pay themselves. The government is supposed to pay them for their work. A laborer deserves his or her wages. So when you work, you are expected to be paid. And in the event that you are not paid, you are supposed to show your displeasure. Only that in this particular instance, we are talking about workers in essential services. By going on strike, there's a lot of disruption. People are dying. So the resident doctors are supposed to take that into cognizance, that look, the Nigerian people are losing their lives. A lot of people cannot afford to go to private hospitals to get treatment. So,
what you're saying, most people, you talk about not having enough good faith when negotiations happen, because that is essential, having heard the rhetoric coming from almost all the parties. So now that they say that the VP is their only hope, can there be any guarantee that yes, if the VP is the only window, these matters will be resolved? Because VP doesn't have the final say, with due respect to him, because he still has to go to certain authorities who have the final say, who perhaps are still or will still be in position, even though the VP is the final say. So what's the guarantee that that will be addressed?
You know, from what the Dr. Ilawa said, and from what I can read by just while he was talking, I can see that they have confidence in the vice president. That confidence alone, you know, it's a big deal, because once you have confidence that the person you are negotiating with is going to, at the end of the day, do something to ensure that all what you think were wrong will now be righted, so to speak, then that is the first stage to getting a settlement. I was going to say, before I knew that the Vice President had intervened, I had been advocating that at this stage where we had come to a situation where both parties could no longer settle the matter, even though the NIC had intervened. I was thinking that at this stage, you know, the president should intervene, because, you know, I remember during the electioneering campaign, he was saying that he was going to ensure that we put a stop to medical tourism and that the health sector will be revived and things like that. Now, since the Vice President has come into the matter, I assume that the President is aware, and possibly he probably is the one who has asked the Vice President to intervene in this matter. But even though the Vice President has intervened and we know they are still talking, it still boils down to the fact that the federal government and the state government have to ensure that the agreements that they have had with these doctors are implemented. Once those agreements are implemented, the MOUs or whatever, the CB collective bargaining agreement, whatever nomenclature they give to it, they should honor those agreements. They should implement the agreement. If they do that, I'm sure the doctors will go back to work. Even if the president does not remove those two ministers as they have proposed.
Well, we'll just perhaps now that they've had that meeting with the VP, and then this health, I think they call it the Health Sector Reform Committee that has been set up by the president with the VP chairing it for a period of 6 months. Yeah. You never can tell. So maybe there will be light at the end of the tunnel. But we do thank you. Yeah, we thank you very much indeed for your perspective this morning, Dr. Rosemary Danesi.
Thank you for having me.
All right. Marpa?